Hi guys, for those who do not know me, my name is Daniel Beltran. I have a PhD in molecular biology and have been um, reading a lot about COVID-19 since the beginning of the pandemic, and I have been basically informing through social media, YouTube about this virus, about the treatments, vaccines, and many other things. Usually I do this in Spanish. But today I find out something I think is quite striking, and I would like to also share with my friends in English, even when I don't have many of those. Okay, but as you know, information is very important, and we are 2 days away from the last, the second and last debate between Trump and Biden, and we are less than 2 weeks away from the presidential elections. And a main topic during these elections is the COVID-19 crisis and how Trump administration has been dealing with it. As you know, there's something that has been said was that the number of cases were decreasing in the US, that we were basically bending the curve and everything was looking fine and less cases, less deaths. But the numbers, as we are seeing them and seeing them now, are just telling the opposite story. We are at the beginning, as it was expected, I was saying, for several months. This is a virus with a seasonal component and is favored in the seasons of fall and winter. And that's what we are doing now in the northern hemisphere. We are getting into the fall, so then obviously, as expected, the cases are starting to increase. But let me just, before I show you what I think is quite striking and may be revealing, uncovering that there is a general plan of lying to us about the real numbers in COVID-19. There's something that we have been suspected, especially in the case of Florida. But I think that today, how the data was coming on the databases from the different governors or states or whatever, were coming in a cadence and with a so striking and weird numbers that make me think, and that's what I want to show you, that there's some type of um, plan that involves more than one state. Okay, so just to show you, I use several different databases, but I mainly use two of them. One of them is the one that we have, everybody's using and showing in the news. There's the Johns Hopkins University of Medicine database, and it's really graphic and nice. The thing is that this database updates every day at the end of the day. But I'm using another one that's a little bit different. It has a little bit, slightly higher numbers, but really, really the same, that update constantly. Okay, and this is the World of Matter .info. And the reason why I like this one is because I was not showing you that one. Okay, so this is the Johns Hopkins. Okay, that's the one that everybody knows and is on the news and everything. But the one that I'm using is very, very, very similar data, and is this one that I'm showing. This, in fact, what you have is a general. It has a lot of advertisements and things like that. But anyways, but basically you have for the whole world, and you can order the countries by the number of total cases, and many other different features. Okay, so let me just focus on the US. So today, and this is just an example, what happened today, there is in the US 63,000 new cases reported and 1,200 new deaths associated with COVID-19 reported, for a total of around 225,000 total deaths of COVID-19. Well, I will not put too much emphasis on this because the CDC just showed this week that probably the associated deaths are much higher than this and were estimated based on the CDC data. This is a federal agency, in 300,000 deaths. Okay, and now we are above the 8.5 million total cases. But what I want to show is what happens. Why do I think there's something weird and fishy here? Okay, so let me just show you how, or explain to you how this database is populated. So that's very simple. So imagine tomorrow, it will show like this at the beginning of the day. So the first states that will start counting and reporting the new cases and the new deaths, other states are in the East Coast. Okay, so you have, for example, the first ones is North Carolina. You have Florida. In fact, Florida reports that very early in the morning of California. So around 11 a.m. To noon East Atlantic time. Okay, so so they are starting to get populated. So New York is one of the first, Florida is one of the first, Georgia is one of the first, North Carolina, and then it gets populated. So as the day, advances, then we have the Midwest states and Texas, and then we have finally the West Coast. And one of the last state reporting is California, is in the West Coast, so it gets this database populated. Okay, but there's something I would like to show you, is that it was already 2 p.m. Pacific, 5 p.m. Eastern time, when out of the 20, I took a screenshot. So I think that you can see this. Let me show it you a little bit bigger. It was already 2, and out of the 20 states with a higher incidence or number of total cases, historically from January till October, out of the 20, there were 5 states, very strange, 5 states that didn't at that time reported yet their numbers. And this is really, really suspicious, because Georgia and and Florida, okay, Georgia and Florida didn't report them at that time. Florida reports that at around 11 a.m. Eastern time, and it was already like 5 p.m. Eastern time, and Florida was not reporting them. And I thought that was really, really fishy. And I would like to give you a couple more data about this, because what I think is that it may be already some type of plan. I don't know from where this is coming. It's something that governors are doing or getting together, but it's really suspicious. And somebody may think that there's some type of plan to diminish or to reduce the number of COVID-19 cases reported. So what we will see facing the elections are not the real numbers, but something different. Okay, so when you look at the data and about these states, there's something very also fishy about how Florida has been reported lately. So one interesting thing is that yesterday Florida reported 3,600 cases, new cases, okay? And today it was reporting 2,100 new cases. This reduction of that deep reduction in number of total cases, let me show you, okay? That reduction in the number of total cases from yesterday 3,600 to today 2,100 in one day is a pattern that when you look in Florida how they are reporting, it doesn't happen. Okay, it doesn't happen. So each state has a different way of counting, but it is standardized. So in Florida, always you get more new cases on Wednesday compared with than Tuesday, not the other way around. So Florida, it was taking them several hours more than usual to get finally their data reported. And when they reported the data, the pattern that they are showing doesn't fit with the pattern that has been showing during the whole pandemic. So there's something really strange here. And the numbers doesn't add up, and the numbers are much lower than expected. And I can tell you that I follow these numbers day by day. I do it, it's like I am really into the data. I am analyzing the data. And there's something that in Florida is really weird. It's very weird that in Florida, they are not closing up. They're, in fact, they are opening businesses and public, you know, public businesses and restaurants and things like that. And they are not implementing face mask usage. And but based on the official data, there is no like increase in number of cases. First of all, if that was the case, it would be the only place in the world that this happened. That already made me think that they are doing something wrong, or they are just counting something different than the real numbers. Okay, they are not reporting the real numbers. And today, what happened with this delay and getting this data so low is really, you know, I am, you know, I cannot say that's for sure, but I can tell you that this is really, 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 really fishy. It's really fishy that it happens at the same time that other five, you know, at around two, what other five states, okay, now let me show you this. So around 2 p.m. Western time, it was already 5 p.m. today, Eastern time. So out of the 20 states with the highest number of cases reported by date, out of the 20 top ones, there were 5 of them that were not reporting the data. Okay? It was really delayed. And you know what? The 5 states are Republican: Texas, Florida, Georgia, Alabama, and Missouri. Correct me if I'm wrong, but I think they're really, really Republican. Texas, it took them very long time too. Quite unusual. Quite unusual. They reported the data later than California. Later than California. It's first time in all of this pandemic that Texas is reporting the data after California does. And that's very suspicious. It happens the same time, the first time that Florida is doing this, also the same day, 2 days away of the final debate where the COVID-19 numbers are crucial to decide the elections in the US. That's very fishy, isn't it? Isn't it? Because I thought that it was in the country of the freedom. And where is the freedom? If I don't have information, I cannot be free. If I cannot see, I cannot be free to walk because I will be hitting the walls. We need the truth. It's absolutely unacceptable that the governor of Florida is negating the right of us to know the real numbers. Not only in Florida, the I don't know how you say the inhabitants of Florida, but also the rest of the US. That's totally unacceptable. But let me give you another number. I will not get too much in the numbers of Texas, because the number of deaths in Texas is really also something that's really starting to worry me, because it doesn't follow the usual pattern in Texas. That's weird. It happens in all other states. It's not happening in Texas, and it's not happening in Florida. In Florida, I can say very clear, they are not providing the real data, period. Period. In the case of Texas, I'm not sure, but in the case of Florida, oh yes, they are lying to you and to me, because they don't care. Whoever the governor of Florida, he doesn't care about you or I or any of his voters. But let me just show you something that is really also intriguing. Let me show you again this database, and let me get back to the US. Because as I was saying, there is a pattern, okay? Not every day. So when you see the new cases per day, you see the new cases, you see that there was a first wave, especially the northeastern states. There was a second wave when really get relaxed and we thought that it was over. And let me show you. I don't know if I'm showing you this. Yeah. So the first wave, Northeastern, with a lot of very high mortality. Remember, mortality was around 6 to 8%. Now mortality is below 3%. Okay, so in the first wave, 8 out of 100 patients died that were diagnosed with COVID-19 died. Now it's below 3, okay, out of 100. Now the second wave in summer, when we thought that we were kind of immune, but I was already saying for a long time, this is a seasonal virus. So we're starting to pick up the third one. And it's not going to end here. It's going to go really high. So probably in November will be above 100,000 cases per day. That's incredible. So basically, we're getting a numbers that one of our days in the US in number of cases equals the whole pandemic in China. Okay, so just think about that. So, but look at this. When you look at the pattern, what you see again, I was explaining, what you see, and let me show you. Yesterday, it wasn't reported in the US. There were 62,000 new cases. Today, 633, a little bit more than 63,000. So it's like more than 1,000. Okay, but I'm saying you every day you have the same. For example, Sunday and Monday, very low numbers. Sunday and Monday. Okay, to the this week, Sunday and Monday were really high, but it was lower. So every week you start Sunday and Monday low, and then you go up, 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 up until Thursday, okay, or Friday. Then Saturday is lower, and then low for Sunday and Monday. Okay, that's the pattern. That's how cases are counted in the US. Okay, but let me just show you something. Today we have only 1,000 cases more than yesterday. Today is a really special day because today is the day that there is a general hiding of the data. And I really think that it's a plan. I don't know if it is coming from the White House or where this is coming from, but I really think there is a plan to hide the data. Okay, it's only 1,000 cases more than yesterday. Let me get today's 21st. What is 2021 minus 7 is 14. Okay, let's go to the 14th. Okay, 14th. We had almost 60,000. What about the 13th? There was Tuesday, 51,000. So it was an increment from Tuesday to Wednesday of 8,000 last week. Okay, let's get 1 week less. So we have the 13th. So it will have to be the 14th. Sorry, there was Wednesday. So previous Wednesday was 7th. Okay, let's go to the 7th. 7th, it was 49,000. What about one day before? 6, 44, 49. So what we're seeing the last weeks, that we are seeing week by week, we're seeing an increment in the number of cases that from Tuesday to Wednesday, we have 5,000, 10,000. This is always a good, a very important increment, okay? This week, where we are seeing these crazy and weird things, okay, in different states, what we are having is only an increment of 1,000. Okay, it's only one day, but there are several numbers that are adding up here that make me question and should make us question, okay, if there is an orchestrated plan starting as today to directly hide data from the American public, to basically make you think that the infectivity of the SARS-CoV-2 causing the COVID-19 is less than what it really is. Let me tell you that even when they are hiding the data in the whole country is so incredible. There's no way, and nobody can basically avoid this analysis. Number of cases are going up, obviously. But look at the number of deaths. Okay, daily, we are going up again. But even with this, I think there is going to be a tendency of making this curve look lower in the following 2 weeks. Okay? I think there is a plan to make you and I think that there is less COVID-19 cases than what they really are, and that basically we are bending the curve and we're getting out of the crisis. That is wrong. And what is even more wrong than this, what is even worse than this, is not only COVID-19, but that somebody thinks that you and I do not deserve the truth. This is the country of freedom and liberty, and we cannot have freedom if somebody is hiding the truth from us, because the truth and the data are the ones that are going to help us take the right decisions. And I want to decide what is good for me and my family. But when the governor of Florida is hiding this data, then the governor of Florida is deciding that his political interests are more important than my life and the life of my family. This is totally unacceptable. Let's see how things progress in the following days. But I hope that somebody will call and ask the governor of Florida why this is happening, and that he can give a better example that, oh no, we're counting differently. I know that the White House, I know that the Trump administration, they asked the CDC not to count the cases and divert this to another independent agency. I don't know how they are doing this, if they are doing this or not, but it seems to me that they have a plan and they are starting to operate this as we speak now. So, well, I will let you go. This is, forgive me for my English. My Spanish, I promise, is much better than my English. That's what I think. And I'm happy to inform you and reach as many people as I can, because you know what? The truth is power. And I hope that the authorities in this country decide to empower us to have better lives. God bless you all. See you soon.